Ophthalmology is one of those strange and almost unpronounceable, mostly misspelled words, but what it means is that I am someone who was a physician first, who then specialized in eye care.
My role as an ophthalmologist is to provide clinical care to patients, diagnosing and evaluating potentially blinding conditions and treating efficiently and effectively when possible. Beyond that, we are looking at training fellows to provide the next generation of ophthalmologists, conducting research to provide the next generation of care for patients, and participating in advocacy to make sure that patients have access to the eye care that they need.
When a patient comes to my office, they bring more than their two eyes. They bring their whole life experience, their family, medical history, hobbies, and interests.
Ophthalmologists are eye doctors who have gone to medical school. A lot of people have doctor before their name, but you really have to look at the MD after the name.
I've spent years of my life working in a hospital with a whole team of medical professionals. I've been trained to lead teams of nurses, other doctors, residents, medical students.
Sometimes patients wonder how long it takes to become an ophthalmologist. They may understand that we've gone to years and years of school, but they can't really relate to that. So if you went to 12 years of high school, you can know that your ophthalmologist went to at least 24th grade. Some of us have gone on to special training, done research projects. Personally, I went to 31st grade.
I'm very happy that the ophthalmologists are right close to me so that I can deal with it at any time, and they're so good that if I call up, they can say to me, come in if I need to.
Nobody in Massachusetts is more than 30 minutes away from excellent eye care. I'm an ophthalmologist and I practice in central Massachusetts. You don't have to go to the big city to get the best.
As a retina specialist, one of the common conditions we see is retinal detachment, a potentially blinding condition. This requires us to go to the operating room and perform vitrectomies to repair the detachment.
One morning when I was playing golf, I noticed a small dark spot on my eye. And as I played more and more, it got bigger and bigger and bigger. And when I got home, I decided to call my ophthalmologist. I thought, well, I'll set up an appointment for tomorrow or the next day. They said, come in right away. 2 hours later, I was having surgery for a torn retina. Eye care is very, very important, as it was in my case. If I had waited a day or two, I may have been blind in that eye. I mean, it was a true emergency.
I see a variety of patients ranging from small children to CEOs to nursing home patients. Each of those patients needs specific care, directions, and reassurance that what we're doing is the best care for them.
I chose glaucoma as a focus because it beautifully combines the disciplines of medicine and surgery. Glaucoma can be managed medically and surgically. We usually start with medical therapy, which is usually in the forms of eye drops. They work by different mechanisms to lower intraocular pressure in the eye. If medical therapy fails, then we move on to laser treatment. Sometimes, unfortunately, both medical therapy and laser therapy are not sufficient, and at that point we proceed to incisional surgery.
A good eye surgeon generally has had good training, keeps up with new treatments and technologies, and is very methodical to be able to produce such elegant work that's required in a surgical procedure.
I operate weekly at a surgical center where I do hundreds of cases a year. Those cases can be anything from complex cornea transplants to one of the most commonly performed surgeries in the United States, cataract surgery. We're able to remove a 10 millimeter lens out of a 2 millimeter incision, working in a 3 millimeter space.
Doing cataract surgery is a highly coordinated effort between mind, eyes, and both my hands and feet. The day after cataract surgery, my patients are often ecstatic, hugging me and discovering their new high-definition vision and renewed color vision.
Later, I developed cataracts, and I had cataract surgery with an ophthalmologist, and it's been fantastic. I do not need glasses for distance at all or TV, so that's been a boon.
During my 1 week rotation in ophthalmology during medical school, I had a light bulb moment. I absolutely loved the rotation. Ophthalmologists get to deal with lasers and microscopes and interesting patients. I just knew from that moment on that that's what I had to do.
It really allows me to fix problems and cure disease that can be so affecting to people's livelihood.
Well, one of the reasons I chose oculoplastics was because I had a patient that I watched get a cosmetic procedure around the eyelids. And I always thought cosmetic procedures, that's not really what I wanted to do with my life. But when she said that she went to the supermarket and a little girl cried because she thought that she was angry at her, and that's what prompted her to get help, that made me really consider what I wanted to do to help people as well.
It's such a pleasure to help people see the world again.
I'm fighting to improve access to care. I'm fighting to break down barriers to that care. And I'm fighting to increase patients' access to medications. I'm fighting for the future of ophthalmology.